The second leading cause of death in the United States is cancer. And certainly there are, hundreds of things we expose ourselves and do to ourselves on a day in and day out basis that we know causes the formation of cancer. There's so much that we could do to prevent so many of the cancers we have to deal with. The third leading cause of death is lung disease. Okay, well, you don't have to go far to find man's involvement with that. I mean, you talked about cigarettes are the ones that smoke, and the people who smoke are the suckers, and that's really the way it is. We're just putting toxic, noxious substances into our body, and we're gonna pay the price for it. And then the fourth leading cause of death, and this is one that usually surprises people, the fourth leading cause of death in the United States today is correctly prescribed drugs. Okay, the correctly prescribed drug. This is from the April 15th issue of the Journal of the American Medical Association, April 15th, 1998. So this is a new study. And depending on the year, somewhere between 100 to 200,000 people die every year from prescription drugs. Over the last 10 years, the average has been 100,000 people. And these are from the correctly prescribed drugs. Leads me to a couple of questions. First off, what's your definition of correct?
Sure.
Okay, I mean, we're talking about, a patient presenting themselves with a symptom, the doctor prescribing a drug that is normally prescribed for that symptom, the prescribing it in the right dosage, and then the patient taking it in the proper manner, and it results in death. In 1997, there was 106,000 deaths. In 1996, there were 198,000 deaths from correctly prescribed drugs. Every year, it puts over 2 million people in the hospital with serious illnesses. Okay, so and those numbers do not include the incorrectly prescribed or the incorrectly taken, and it does not include drug interactions.
Wow.
Okay, so the fourth leading cause of death is simply the result of man trying to change his symptoms. Trying to alter the way he feels as opposed to taking care of what's not working right.
Unplug the idiot light.
They're unplugging the idiot light. Yep. Meanwhile, they're driving another mile down the road and the car's throwing a rod and the engine blows up. Along the lines of the prescription drugs issues, and as far as what we do to deteriorate our health, and that brings up the issues of vaccinations.
Oh, tragic.
It is a fallacy of science. We have been duped into the immunization vaccination process.
You're right.
We give our infants their first injection when they're 1 day old, and we're injecting them for hepatitis. Now, hepatitis is a serious health problem. Mm-hmm. It is predominantly found in intravenous drug users and prostitutes.
Right.
Okay, that's some of that result of sin. Willful sin illness situation.
You're doing it to yourself.
You're doing it to yourself. Unfortunately, the pharmaceutical companies have spent literally millions of dollars developing a vaccine for hepatitis. It's not very effective. As a matter of fact, the hepatitis vaccine is the only vaccine that the incidence of disease actually went up after they came out with the vaccine. So we didn't do anything to influence the incidence except spread it.
Yeah.
We give our children their first immunization against hepatitis when they're 1 day old. The vaccine at best is good for 5 years. Okay, which means before this child is at risk, reasonable risk, okay, i.e. Intravenous drug user or multiple sex partners, okay, they're going to require 3 to 4 of these vaccinations
before they reach 20. The
vaccine contains formaldehyde, which is a known carcinogen. The vaccine contains mercury and aluminum compounds, okay, which are known toxins to the neurological system.
How does the body get rid of that?
It doesn't.
It can't.
It can't. It accumulates in the neurological tissue, okay, and interferes with its function. And as we've talked earlier, if you interfere with the function of the nervous system, you are now influencing all the other body systems that we have. The increase of aluminum and mercury in our vaccines has been linked to things such as attention deficit disorders, autism.
We give the kids Ritalin.
We give the kids Ritalin
instead of
not
vaccine.
stopping the vaccine process. You know, there's also other issues involved when you start talking about attention deficit disorders. That leads us into the nutritional aspects of it.
Yeah.
But Ritalin is just another example of, you know, an allopathic remedy trying to affect an opposite reaction than what the body's demonstrating.
Okay, now the average American that's going to watch this tape or listen to this type of conversation is going to say, "What? Don't vaccinate your kids."
It is one of the last sacred cows
I tell you.
in our society. But I mean, I have 3 children. We haven't vaccinated them. And they do attend public school, by the way. That is one of the common lies, that if your children aren't vaccinated, they can't attend public school.
Right.
Okay, we can deal with that issue a little bit later. But even my own mother, I mean, for 8 years, okay, every time we spoke, it was like, I can't believe you're not immunizing those children. What do you know, you're just, you know, you're playing Russian roulette with them.
How's their health?
It's excellent.
How old are they?
I have a 17-year-old, a 14-year-old, and a soon-to-be 10-year-old. And the 10-year-old was at a medical doctor's once, and that was when he was 3 months old, and that was a mistake. My son had some weakness in his lungs. That was his vulnerable area. And so when he was young, he'd get sick and it'd settle into his lungs. When he was about 3 months old, he got pretty sick, had a pretty good case of bronchitis going, and Mom was getting nervous. I mean, I'm trained in this, you know, and I've been seeing a chiropractor since I was 14 years old, so I've been having philosophical and studies in these issues for a very long time.
Right.
My wife is a little bit greener at this, and I learned a long time ago that you don't get in between mother and child.
Right.
Okay, that's just a bad place to be.
Right.
That's worse than the rock and the hard place.
Right.
So I told my wife, I said, listen, if you're getting uncomfortable and you want to take the child to a pediatrician to get checked out, that's okay. You're not going to step on my toes. Well, go listen to what they say. And well, of course, they diagnosed him with bronchitis and proceeded to prescribe him amoxil, the pink stuff.
Right.
So started giving my son amoxil, and about 3 days later, he broke into this fine rash, just a red rash all over his body. Took him back to the medical doctor, and a different doctor walked in and took one look at my child and said, "Oh no, this baby has roseola," and proceeded to write another prescription. You know, so we walked out of the doctor's office, and I turned to my wife and I said, "She's a quack." You know, I love that because for 15 years now I've been called a quack. Call me a quack, so it was now my turn. But they went home and looked up drug interactions, and there was a picture of my son. I mean, you know, he just had the red rash, just a classic penicillin rash. Woke up the next morning, and my 3-month-old son was swollen, had welts on top of welts. His little finger was as big around as my thumb. I mean, he's just swollen up like the Michelin Man. Well, we let those toxins work their way out of the body, that's what a drug is. Drug is toxic,
Right.
By definition. You know, it's a poisonous substance. Mm-hmm. So we let that clear out of his system a little bit, and continued to give the conservative care that we do. He gets chiropractic care. He got chiropractic care when he was 2 hours old. My children get treated once a week, regardless of how they're feeling. If there's nothing distorted, well, then I won't move it. But if there is a distortion there, then we want to catch it as soon as possible and take care of the problem.
Okay.
And what we found happening was, as he got older and older, his weak area was still his lungs. And when he first got sick, he'd be sick for 10 days to 2 weeks. And then he'd get a little bit older, and he'd get sick, catch a cold or flu, and it'd settle into his lungs, but he'd only be sick for 7 to 10 days. And then he'd get a little older, and he'd catch a cold or a flu, and it'd settle in his lungs, but he'd only be sick for 3 to 5 days. And now when he starts struggling, okay, and struggling with a cold or a virus or something along those lines, flu or something, well, it will settle into his lungs, but he throws it off in 24 to 36 hours. My son has not been on another drug since that first time.
So what do you say to a parent? Their kid's 15.
Mm-hmm.
They've already had them, all the vaccinations, been on drugs 15 years.
Right.
You know, get sick, go to the doctor, give them a drug.
Get a drug.
How do you fix it now? Have they done permanent damage?
Well, actually, my colleagues and I have spent a lot of time debating that issue. We know that when you inject noxious substance like aluminum and mercury into your system, it's there forever. It takes divine intervention to remove it. Mm-hmm. God can do that. It's his universe. He can do whatever he wants. But from the physical realm, okay, it stays in those tissues.
Does this mercury come from teeth filling also?
Yes, and that's why a few years back, I believe it was 1990 or so, the American Dental Association went through a massive recall, okay, and encouraged all. It was on the news and everything. If you've got mercury fillings from this time period, get into your dentist and have those fillings replaced. Okay, so a whole lot of people went in and had the mercury cavity or fillings taken out and replaced with another substance, because what was happening was just a little bit of that mercury was being leached off of those fillings and finding its way into the nervous system and causing toxicity.
Wouldn't they get, just in the process of removing it though, you'd swallow more then than you would in a lifetime, wouldn't you?
Yeah.
So you really
Yeah. It's really not
not a good option.
Not a good option.
Don't get it in the first place.
Right. You know, it's funny. I know just a couple weeks ago in Kansas City, there was a medical clinic that closed down because they somehow got a mercury spill in their office. Okay, and I don't know, I imagine a sphygmomanometer or something like that busted, okay, and those things are filled with mercury.
Right.
Okay, and you know, when you make a spill like that, some of the molecules start evaporating into the environment. So they had mercury compounds in their environment. So they closed the entire clinic down for 3 days. Okay, while they got in there and ripped up the carpets and filtered the air and, you know, cleaned up everything. And they concentrated on opening the second floor of the office, okay, and they got the second floor open first. And the reason they did that was so they could start giving the immunizations, okay, on schedule.
So start putting it straight into the bloodstream.
Right, exactly. We don't want you to breathe any of this mercury,
But we'll shoot it in
but
your
we're
brain.
going to inject it into your blood system, okay, in the name of prevention.
Okay, from vaccinations, how many kids die from these things?
Well, we experience somewhere between 2 to 10 deaths every year from vaccinations. Immediate deaths, catastrophic in nature.
Okay.
People get the shot, children die, and there's no debate about it.
obvious.
It's obvious.
The vaccine did this.
That's why we have what's called the National Childhood Injury Act. Okay, not everybody's aware of that. Our federal government has a slush fund of money set aside, okay, to pay off the parents of the children who were seriously damaged or killed from the vaccination program.
You have a
Okay.
phone number for that?
Not for them directly, but we do have another phone number for the National Vaccine Information Center.
Okay.
Okay, which is a good place to start if you suspect that your child has been injured. It's real hard to prove that.
Sure.
Okay, doctors stick together real tight.
Oh, yeah.
Okay, the pharmaceutical companies, they're the ones that lobbied for this bill. You know, pharmaceutical executives have said things, for example, with our hepatitis vaccine. The only reason we vaccinate our children for hepatitis is because children are accessible. Children cost less money to vaccinate, okay, and the high-risk groups aren't accessible. Okay, the pharmaceutical execs during the debate as to whether or not they should start immunizing children, their response was the last thing we need is an orphan vaccine. Okay, they've just spent literally millions of dollars on it, and they're going to inject it into somebody.
Could there be another factor that young mothers with young children are less knowledgeable and easily deceived?
We have been taught that the doctor is all-knowing
Right.
when it comes to health. Okay, and we have been programmed to put blind faith in that doctor. As a matter of fact, I've always encouraged my patients to ask the magic question, why? When you go see any doctor, and
He says, take this drug.
he says, take this drug, your first question should be, why? What is this drug going to do? What's
Yeah.
the benefits of it? What's the side effects of it?
Right.
Do I have an alternative? And many times as patients have gone down that road, the doctor will simply look at them and say, take it because I said so. It's too complicated. You wouldn't understand.
Mm-hmm.
They've been put up on this pedestal of all-knowing health.
Right.
Okay, and we've been taught not to question them. And that's blind faith. And blind faith is,
Oh.
is
Well,
dangerous.
I'm
in
not
that.
anti-medical by any means, but
No, there is a time and a place for medical
oh man,
intervention.
yes, and I've been many times to the doctor. But I think if you look at the results, the Hunza tribe in India, or Pakistan, Nepal, wherever they are,
Mm-hmm.
has an average life expectancy of over 90.
Right. It used to be higher.
Used to be 150 or 60 when they were
Right.
first discovered.
Exactly.
It's
When the
incredible.
tribe was first identified, it was up around 160.
Yeah.
And it was an amazing culture. I mean, primitive by all,
Our standards, right.
Western standards, but yet these people were living much longer than we ever were. And of course, the medical teams went in there and did all these evaluations and tried to figure out what was going on, and things like that. And these people were basically pictures of health.
Yep.
Okay? The only thing that they found that concerned them was that their stools tended to be a little loose, that they were prone to diarrhea.
Right.
Okay, so in our wisdom, we decided to start giving them drugs
To help this
to
problem.
help.
Right.
Okay, this elimination problem. And as a result of our drugs, we knock